Very good. Thanks for the introduction, and thank you all for coming. So this is the title of our talk. This is work I do with Dr. Garcia and Dr. Wharton at the Montefiore Medical Center. And this is my disclosure slide, since we all have disclosure slides. So I'm the founder of Stenomics Incorporated, which is a company that's actually developing the EchoPlan software that I'll talk about. But I also have another disclosure to make, which actually didn't meet the ASC guidelines, so I'll just tell you what it is. And that is I'm a mathematician. And so I'm not a cardiologist. And so I promise that I will not have any complex formulas or numbers or anything or give any math quizzes or anything. But my Hippocratic oath is that I have to have some kind of numbers or formulas or something. And so they will be in here, but I will keep them to a minimum. So this work that we're doing at EchoPlan really isn't about me, though. It's about the 550,000 Americans just in the US who have severe symptomatic aortic stenosis. And this is a big deal because if these patients are not treated within 2 years, 50% will die. If they're not treated within 3 years, 80% will die. And one of the most common treatments is aortic valve replacement, either via surgical aortic valve replacement or TAVR. And there have been a lot of discussions in this in the ASC meeting here about TAVR. And we wanted to show you that the workflow for a TAVR patient is quite picturesque, in the sense that the patient starts out, goes in for a consultation, will often have a transthoracic echo, a TEE, then a CT exam for determining the proper size of the annulus and therefore the valve, and then that data are given to the TAVR heart team, which determines the size of the valve and ultimately goes into the cath lab, and then hopefully there's a good outcome. So the path from patient to treatment is very scenic and very windy. And you can see actually in this picture here that the woman who is probably the patient in the upper left corner has a very different color of hair when she starts than when she ends. And so we looked at this workflow and said, can we improve upon it? Can we make it better, both for the system and for the patient? And we said yes. If there was a way we could eliminate TEE and CT and go right from a transthoracic echo with very accurate anatomic data, with an accurate aortic annular size, and therefore give an accurate size of the TAVR valve, then we could eliminate all that and go right from the transthoracic echo to the heart team to the implantation. And that's what we're working on. Now, we certainly understand there are benefits to doing a CT. So a CT is highly accurate, gives a very accurate reading of the aortic annulus, and is often thought to be the gold standard. Because of that, an accurate, proper valve size is often chosen, which reduces the incidence of paravalvular regurgitation and often gives better outcomes. On the flip side, however, up to 35% of patients are at risk of experiencing contrast nephropathy, and 20% are often contraindicated to the contrast dye. So there's risks associated with doing CT, and if we could get that out, or at least to minimize the reliance on CT, especially with contrast as part of the TAVR workup, then that would be a huge benefit to the patient especially. And so that's what we're working on, and EchoPlan does exactly that. So EchoPlan is computer software that uses only echo data and complex mathematical formulas and formulations and algorithms that we can talk about in more detail later to compute CT quality annulus sizes purely from echo. So we use 2D echo, we use 3D echo if it's available, and perhaps most importantly, we also use the Doppler data. So we're using Doppler flow data to tell us something about the anatomic size. And that's our novel invention. So we have fancy mathematical methods that rely on solving partial differential equations, using machine learning algorithms, solving Navier-Stokes equations. But this is all transparent to the actual user of our software. And so the inputs to our software are standard echo images, standard Doppler data, and we extract the information that we need from that. So how does this software work? I mean, what's the algorithm behind it? What's the intuition behind it? And the answer is simple. The flow is actually telling us something about the size of the anatomy. So if we think about a garden hose, the speed of the water that flows out of the garden hose is related to the size of the end of the hose. So if we put our thumb over the hose, it's a smaller cross-sectional area, the flow goes faster. And actually, we know this already because the continuity equation that's used to compute the effective orifice area is using this same principle. What goes in must come out. And so at EchoPlan, we figured out how to use this same methodology, this same technology, and apply it to the aortic annulus to compute very accurate measurements for the aortic annulus. So when we incorporate EchoPlan into the TAVR workflow, we get rid of the CT, or at least we reduce the reliance on CT for sizing of the annulus. And then we can also get rid of TEE and go right from that to, we can, is there a way to close that? No? Okay. So we can go right from the transthoracic echo and give the TAVR heart team the very accurate data they need for sizing the valve, for implanting the valve directly from the transthoracic echo. So we have a full working prototype of the software. We've used it with transesophageal echo. We validated on 10 patients I've shown here. We're actually up to 15 patients now. And on the y-axis shows the annular size on the, computed from either the software or from 3D echo. And on the x-axis shows the corresponding CT size of the annulus. And the black line that goes from the lower left to the upper right is perfect correlation. So that's when both of the sizes match exactly. The blue line that's below the black line is the line from 3D echo. And it lies below the black one because 3D echo is known to undersize the annulus. And contrast results from our software. The size of the annulus measured from our software is in the red line, and there's almost perfect correlation between what the software produces and what is obtained from CT. So in summary, EchoPlan is really a win-win-win. It's win for the patient. There's no radiation. There's no contrast dye. There's fewer exams. It's win for the physicians. It's easier to manage the care. And it also expands the indication or eligibility, if you will, for TAVR, because even patients who are at high risk of contrast nephropathy or maybe contraindicated to contrast dye, who may be ineligible for TAVR otherwise, can use our system, our software, from straight echo and get very accurate sizes of the aortic annulus. And of course, it's also a win for payers, insurance companies, because it's a lower cost and a lower risk for the patient as part of the pre-TAVR workup. So that's what I have. Happy to take your questions, and Dr. Garcia will join me on stage here. Thank you.